All right, just a second, and I will bring up our presentation screen here where you can see this. Bigger. All right. So for those of you who participated in the first session, welcome back. And for those of you who are just joining us for the second session, excuse me, I want to welcome you to SEPA for transgender women. And this is a HIV, STI, mental health, substance use, and intimate partner violence prevention program for transgender women, specifically for transgender women living in South Florida. So I'll tell you a little bit more about the session and how it works throughout our session today. First, I want to acknowledge our funder. The person who provided the money for this study is the Our Fund Foundation, and they are based in Wilton Manors, South Florida. Wilton Manors, Fort Lauderdale, sorry. And they fund LGBTQ plus projects. We're also partnering with the Yes Institute and Survivors Pathway. So I would like to acknowledge both of those community-based organizations for partnering with us, and for the Our Fund Foundation for giving us the money to do this study. So this is session one. Welcome to session one. And this is called HIV in Your Community. And you're going to get a little bit of the basics of HIV in session one. And we're going to continue that and add sexually transmitted infections in session two. And I'll tell you a little bit about session three as we go along. So what is SEPA? SEPA is an intervention that was developed by Dr. Nilda Nena Paragallo. She was the former dean at the School of Nursing and Health Studies, and she developed this intervention for Hispanic women in Chicago in the early 2000s. And this intervention has been adapted for Hispanic women in South Florida. It's been adapted for Black women in South Florida. And now we are making it available, adapting it and making it available for for transgender women of all races and ethnicities in South Florida. So SEPA stands for Salud or Health, Educación or Education, Prevención or Prevention, or Autocuidado or Self-Care. And these components are threaded in the three sessions of SEPA. So the goal of this, and in this recording that you're listening to, we're just presenting the information of what we would include in the intervention. Ideally, the intervention would be offered live on Zoom, or it would be offered live in person. And the hope, the goal of this intervention is for participants to share their opinions and doubts, talk about their anxieties and suggestions, exchange ideas, and to learn, and to help each other, to help ourselves, our families, and our communities in which we live. And all of that's built into this SEPA intervention. Okay, so if we were giving this as an actual session, this is where we would give opportunity for each participant to introduce herself. And we would also talk about the expectations and the commitments. And of course, the facilitators, there would usually be 1 to 2 facilitators, would also give an introduction and would kind of lead the whole group process. And this is kind of like a psychoeducational model where we're using the group process to educate people about a certain topic. So these would be the group commitments or the rules that we would ask everybody to adhere to. during the sessions, whether the sessions are on Zoom or if they are live. If they are on Zoom, of course, that we would have another little box in there that would say, please turn your camera on and mute your microphone unless you were talking. All right. But if it's going to be in person, these were kind of the rules that we would kind of go over. And we wouldn't really call them rules, we call them group commitments. And then we would ask if there's any other commitments that anyone else would want to add to this list. We also would ask all participants to recite together this confidentiality pledge. And this is to make sure that people who are in the group feel comfortable sharing their opinions and sharing their, what they believe and what they don't believe without being judged and without it being talked about outside the group, kind of like the, what happens in Vegas stays in Vegas type thing. We would also open up this session about a little discussion here about what does it mean to be a transgender woman. And we would want participants to talk about their transgender identities, their, racial, ethnic identities, how those kind of intersect, and what it means for them to be a transgender woman living in South Florida. And then we would want to know what are some core values that we would need to know as facilitators for communicating with transgender women, and some that we have identified from the past. Respect and recognition of the whole person, bodily empowerment and autonomy, freedom from fear and shame, and taking the stigma out of HIV prevention and treatment. So we would ask women to also give us more core values that we would need to incorporate in this intervention. But these are the ones we've identified so far. All right, so we would start this session with a little movie clip from a popular television show that many of you may have seen. I watched it when it was on FX and loved the series. It was called Pose. I think it was 3 to 4 seasons, and it was about a group of transgender women living in New York City during the 1980s during the HIV epidemic. So this one particular scene here that we would show talks about a transgender woman named Bianca who shares her story of how she got HIV because of her engagement in survival sex work. And so if you are living with HIV, or if you are, engaging or have engaged in survival sex work in the past, this clip may be difficult for you to view, and we would ask you not to view it, and would make a way for you to step out while we are reviewing and discussing this scene. Okay. And again, we would offer an opportunity to talk about this privately at the end if it was found to be upsetting. All right. So in this, excuse me, in this session, this recorded session, I'm not going to show this movie because it takes up too much space when we send it out, but I will send the link. And if you are comfortable seeing this clip from Pose, watch it. And if not, please, please skip it. We don't want to, re-traumatize anyone who has, any trauma or any issues, either from diagnosis of HIV or of survival sex work. All right, so then we would begin, after we had the little discussion about the Pose clip, we would be talking about HIV and the transgender community. And I'm not going to go through all of these because, again, I'm not teaching you here. I'm just showing you what we would teach. But I'm going to present this study that was done by the CDC that looked at HIV prevalence among transgender women in 7 cities in between 2019 and 2020. And I believe Miami, Fort Lauderdale were included in this data. So you see, of all the women that they interviewed, 42% of them had HIV. And the biggest chunk, the largest chunk of these were among Black or African American trans women, followed by Hispanic, Latina, and then white. And all of these rates are much higher, even than the general population. And some of the rates, like among Black, African American, and Hispanic Latina, are even higher than the MSM population. So, MSM is men who have sex with men. So here we would highlight the need for, this intervention for women, both at risk for HIV and women who are living with HIV. And by the way, this intervention is both for women living with HIV and women not living with HIV. And also it's for women who don't know their HIV status. So we did not want to exclude anybody. We want to make this intervention useful for everyone. Okay. And this is kind of a different little thing here that shows you a little bit more of the whole 625 women that they interviewed, and it shows you the percentage that were living with HIV. Okay. And this looks at the age groups, and you can see that the 25 to 34 is the highest. Okay. But don't get fooled by this slide here, because when I show you the next slide, you're going to be a little surprised about this. But you see the 13 to 24 is the second highest, and then it's 33 to 44, and then it kind of like slopes off a little bit as you get older. And that is not saying that people 55 and older do not get HIV. That is not what we're saying here, but this is just what this study showed. But look at this. This is why I told you not to get too comfortable. If you look here, the 25 to 34-year-old age group between 2015 and 2019, their rates of HIV increased by 24%, right? The 13 to 24-year-olds, which were the second highest, they went down by 11%. And then the 35 to 44 went up 19%. And then look at the 55 and older. Even though it was a small number, their numbers between 15 and 19 increased by 71%. So this intervention is designed for transgender women 18 and above, 18 and as old as they want to get involved in the intervention. We don't do anyone less than 18 because technically by law for research, we would have to get parental consent, and we don't want to deal with that. And we don't want to deal with those issues of maybe the parents not knowing, the information about the person less than 18. So we'll just stick to our 18 and above. And we can see here that the work that we really need to target, the groups that we need to target, 24 to 34, 35 to 44, and then 55 and older. Okay. And of course, we'd show this slide knowing that Florida is in the South. Our new diagnoses among transgender people, about 50%, 43% exactly, happened in the South. So the South is also a hotspot for HIV infection. And of course, the transgender community, the transgender women's community, definitely falls into the South, in the highest in the South. Okay. If we looked at this by state, Florida would be the 4th place. And you can see the transgender women living with HIV. There were 602 in 2019. in Florida living with HIV. So interesting information. So when we move it back to our Florida area, here's some things that research has shown has an impact on the high rates of HIV in the transgender women's community. All right, the first one's poverty. Again, I'm going to go through these very quick. Poverty, if you don't have a job, you're discriminated at your job, or you can't get a job because of discrimination, you might be forced into survival sex work. And so the poverty is a risk factor for HIV. Lack of insurance, the same thing. You may not have access to a healthcare provider if you don't have a job, you don't have insurance, you don't get any funding, or you've had a bad experience in healthcare. It might result in you getting HIV infection because you're not getting HIV prevention care. Inadequate HIV data. Believe it or not, in 2024, unfortunately, some transgender women, when they're diagnosed, they're categorized in the men who have sex with men category. We know that's wrong, and they're trying to fix that, but some of that data is definitely wrong. There's not a lot of state and federal funding for prevention and for care and treatment programs. If you're engaging in survival sex work, that puts you at risk for HIV. If you have HIV and you're engaging in survival sex work, there's also a chance that you could be arrested, not only for survival sex work, but for having, sex while you're living with HIV, and if you didn't inform your partner. So there's some criminalization that could result in jail time for both survival sex work and having HIV. And of course, we know in Florida, there have been a lot of attacks on LGBTQ plus people. And with the T being transgender, there's a lot of attacks on transgender people specifically. Okay, so here we would talk about the difference between HIV and AIDS. We would make sure that the person understands the difference between HIV and AIDS, knowing that, they are different, they are related, but that every person living with HIV does not have AIDS. So we would make sure that the women would understand the distinction. All right. We would give a little talk here about the defense system that our immune system does, how it protects us against germs, bacteria, viruses, and fungi. And you can see this little diagram shows these little bodies as our immune system fighting off these organisms. Here we would talk about the natural progression of HIV. We would teach about acute HIV infection as a flu. We would move into the window period of the period when the person may actually be living with HIV but doesn't have a positive antibody test or a positive HIV test. We'd go into the symptomatic period, explaining that the person has symptoms, or they may not have symptoms, but they would test for HIV. And then the symptomatic period, which can go up to 10 plus years, after 10 plus years, and we would go over some of these symptomatic signs and symptoms of HIV that would educate women in case they were not aware of these things. All right, here we would talk about how we can't look at a person and figure out if they have HIV or not. All right, most people with HIV look very healthy, and so there's not a visual test, if you will. All right, and we would make sure that the people participating know that a person doesn't die from HIV or AIDS, they die from complications. And it would be important to note that medical science is still working on a cure for HIV infection. It's been going on since 1981, and they're still working on a cure. All right, so Here we would talk about how do I know if I'm living with HIV, and the only answer to that is to take an HIV test. HIV is a laboratory diagnosis. So without a laboratory and a test, you can't really know if a person's living with HIV or not. Okay. Here we would go over the HIV tests, the difference between the rapid testing and the fourth generation testing. And, we would ask, women who had HIV test if they were willing to share, which one did you have? Did you have the rapid test, or did you go get the blood test where they drew blood from you? And we would talk about the advantages and disadvantages of both. The good news is both tests are like 99% effective. There's in diagnosing HIV infection, and we would just make sure that the participants would know the basic differences between the two. Okay, same thing here. How do we know if we're living with HIV? It's the same thing. We got to get the laboratory exam that would either confirm or rule out that we have HIV. All right, so with HIV, we would want to get diagnosed early, because when you get diagnosed early and you start medications early, you know that this keeps your immune system intact, and it doesn't allow opportunistic infections to happen or secondary infections, and it keeps the person healthy, right? And so we would throw out the question to the audience, why is it important to know that the person has been living with HIV? All right. Here we would go over the bodily fluids that transmit HIV. Nothing's really changed here. Of course, blood still being the most common. Semen, sperm, or cum, okay, would be the next. And then vaginal secretions, and then breast milk, of course, could be. Okay. And here we would also talk about substance use, because remember, we want to also address substance use in this intervention. Sharing needles, not only for injection drug use, but maybe sharing needles or syringes for administration of hormones, or even using, the same needle or syringes for any type of cosmetic enhancements that want to be done, that are done, outside of a medical facility. So these are ways that HIV could be spread. But we also talk about, being drunk and being high, and how that contributes to engaging in unprotected sex. All right. So again, substance use is a big part, in HIV prevention. All right. Here we would review how HIV is transmitted from one person to another. It's mostly sex. With a person living with HIV who doesn't have condoms, of course, we can talk about mother to baby. We can talk about blood transfusions, but that's relatively rare in the US, if at all. And then, of course, we would reinforce the sharing needles would be a source of transmitting it from one person to another. Okay, so here we would talk about this would be our nice little breaker from all that information, and get the women involved and get them talking. So what are some of the ways that HIV is not transmitted? And this would be an opportunity to correct some myths, right? Like if somebody says, oh, you can get HIV from drinking after a person who has HIV, drinking from the same cup. And we would have to correct that information and then re-review what we taught, so that we would all be clear on how HIV is transmitted and how it's not. So here we would present the what we call the behavioral or the biomedical piece of this. And the ABCs are what we consider the behavioral. And the first one, A, is for abstinence. And for those of you who reviewed this content, a lot of you gave me feedback, oh, get rid of that abstinence. Nobody is abstinent. And I agree with you 100%, but it is a method of HIV prevention, right? It's not for everybody. Hardly anybody is sexually abstinent, but it is an option. It's the A and the ABCs, right? B is the be faithful, and that's the mutual fidelity with a partner, all right? And then the C is the correct use of condoms, either male or female, which we will talk about in another session. And then the second branch of this, which we'll talk more about in session 2, is what we call the biomedical. And these are medications that we use PrEP to prevent HIV, doxypep to prevent certain sexually transmitted infections, and then U equals U is for people living with HIV so that they can get to undetectable, which will mean that they are not able to transmit HIV to other people. But we'll talk about these two things much later on, but we're just introducing it here in session 1. All right, so in this is a new slide I added for those of you who saw the first sessions. Somebody said, well, why don't you go in depth and tell these women what's their risk for HIV? And I was like, oh, that's a good idea. So they asked me to, include like what's the risk for tops or bottoms, but I included more information here. But here's the thing: if you're a bottom, meaning that somebody is putting their penis or their dick into your anus or your ass, your risk is 1.38% every time you have unprotected sex. All right. And if you are engaging in anal sex as a top, meaning you're putting a penis or a dick into an anus or an ass, it's 0.11%, which is much, much lower. And you can see the lowest here is really oral sex, giving head, all right? But when a person has HIV, all right, and even if you're engaging in any of these unprotected, all right, and unprotected means without, without a condom or without being on PrEP, for example, the U equals U is 0%. So for me, in my lifetime, I grew up in the 80s, seeing people get very sick and see people die from HIV. This is like incredible that we can reduce the risk down to like 0. So this is good information, and this is good information for women to know that if you're engaging in unprotected sex and you're not using a condom, you're not on PrEP, and you don't know the HIV status of your partner, here's your risk for HIV. All right. So at this point, we would go over this homework assignment. We would give in 2 of the sessions, session 1 and session 2, we would give homework, and here we would ask the participants, we would give them this homework on a sheet of paper and send that home with them, or email it home with them if we were given it via Zoom. And we would ask them to talk to their neighbors or friends about HIV, and then talk to their neighbors and friends about any rumors and myths that they may have heard regarding HIV, and then discuss the following questions with the person, about condom use. All right. And so what we would do with this, we would ask women to complete this at home on their own, and then bring this back next week, and we would start the discussion of this next week. All right, at this point, if we were in person, we would pass out a session evaluation on paper and ask the person to rate the session that they just participated in. And if this were on Zoom, we would send a link and ask each person to complete the evaluation. And we would be asking them if the information was helpful, if they learned something, what might need to be changed, what might need to be added, et cetera, et cetera. And as I said, we anticipate in these sessions that if we were having these live sessions, these would probably be 1.5 to 2 hours in length. with all the discussions and everything. But here, as you see, it's much quicker because I'm not actually teaching you the information. I'm just showing you the information that we would present and have you to evaluate that information. Okay. At this point, we would invite the participants who might need a referral or need more information. So for example, at this point, let's say that a woman comes to us and says, well, I've never been tested for HIV and I don't really know where to go. I want to get tested, but I don't know where to go. And we would be able to give them information on where they could get tested for HIV. Okay. And then the same will happen for each of the other sessions. If we're talking about STI, sexually transmitted infections, we would have those resources available. So this would be our chance where they could speak to us privately at the end of the session, either by Zoom or by, in person, and we could help them with that referral information. Because part of our intervention is also to make them aware of any services that are out there and to refer them to these places if they're not aware. Okay, this is where we would be thanking them for participating in session 1 and thanking you for participating in session 1. When you finish listening to the session, please call me, text me, or email me and set up a time that we can go over the session evaluation. It shouldn't take any more than 30 minutes. And we can do that by phone. And also, you will be paid $50 via Zelle for participating in each of these sessions. All right. And there are 3 sessions, so you have an opportunity to make $150 just reviewing these very short programs. Again, I thank you for your time. I know your time is very valuable, and the input that everyone gave us in the first round of this really helped us improve this these sessions, and I would love to hear your feedback on these sessions. So please email me or text me or call me, and we will set up a time. Thank you so much.